Hey guys, I'm Britt Thelemann Pangerl and so excited to be hosting Endocast. I think this is a perfect fit for me because I'm living it. I'm living with endometriosis. I was diagnosed with stage 3 disease via laparoscopic surgery in January of 2018. I'm 32 years old and I got my first period when I was 15, so a bit of a late bloomer, I would say. And I don't necessarily remember it because I think sometimes we like to block trauma out in our lives. But in chatting with my mom, she said that I was always in pain in high school. And, she's a dentist. So our house was always, take some Advil or Tylenol, do some stretching, figure it out. But you have to go to school. You've got to get stuff done. And so I've always kind of had this mental toughness around physical pain and roadblocks and how I could just kind of bulldoze them. So that's how I approached pain with my periods. And it was pretty much pain with my periods during high school. And then in college is when it really came to a head for me. So I grew up here in the Twin Cities, and I also went to college in the Twin Cities at the University of St. Thomas. And it was my freshman year, and it was right before our first big bio final, first semester. And I was keeled over in pain, throwing up. I even passed out from pain in the bathroom, and my wonderful roommates at the time helped get me to the ER. I was still seeing a pediatrician at the time at almost 19 years old, 18, and so I went to the children's hospital, and they had a rotation of surgeons and doctors and residents coming in. No one knew what was going on because, of course, now we learn that hindsight's 2020 and endometriosis isn't seen on so many scans. So everyone just said I probably had an ovarian cyst burst. I had a lot of fluid in my pelvic cavity, but all I knew is that I was in a ton of pain. And I had been going to a gynecological practice here in the Twin Cities, pretty well-known one, since I got my period. And they just recommended that we start on birth control. And that was a challenge, being Catholic and unmarried and, kind of winning my parents over that, no, this is to treat a disease, and birth control, or I just like to think of it as hormone therapy, can be used for things other than just preventing pregnancy. So I started that, and that was a journey in and of itself that I think a lot of people can relate to. Whenever you start manipulating your hormones, it really starts affecting a lot of other parts of your body, especially your brain. So in college, I struggled a lot with anxiety, severe depression, and kind of understanding and finding some sort of love for my body. I also experimented a lot with diet and trying to see, okay, is it a gluten problem? Because my symptoms were progressing. Now I was no longer having pain with my periods, but I was having pain with bowel movements and pain with urination. And it's so uncomfortable. I had always had a problem with constipation. And then, so I started experimenting with my diet. Fast forward a little bit to finding a better birth control and doing a little bit better mentally. And again, I just was on this trajectory. I was not going to let this disease slow me down. And I had been on birth control for, over 10 years at this point. And I met my husband, and we decided after getting married that we were ready to start a family. And that's where I think my endo symptoms really kind of flared their head, you could say, because I went off the birth control now for the first time in over 10 years, and I had every symptom in the book. If you Google endometriosis, you'll see a long list of things. So heavy periods, painful periods are usually the top two. But then after that, you've got your pain with bowel movements, pain with urination. I was having pain with sex, pain with intercourse. I was having pain all the time, not just pain during my period, pain during ovulation. One thing that really stuck out to me towards the end was this pain that was like a fish hook. If you can imagine, this is gross, but through my belly button, and it felt like I was kind of being gutted from the inside out. And that would happen usually a week or two after my period, and it was constant, and I couldn't wear anything that touched that part of my body, like if clothing did, and no one could figure it out. And I was on this hamster wheel of doctor's visits every 3 to 6 months going in, and then I was met with I think you're just getting frustrated because you're not pregnant yet, because now we were on the infertility track. And I finally said there's got to be a better way, because this is so uncomfortable. No one should be leaving work in pain, crying. I mean, my husband had offered to pick me up from my office because he was afraid that I shouldn't be driving. And I didn't know what to do. The doctor's office just said I was being dramatic. They had been giving me painkillers. And they finally offered to schedule surgery after a nurse practitioner said to me, "What, do you want me to just have them cut you open?" And I guess I had never faced anything like that as a patient or as a person before, where someone in the medical profession was questioning the validity of my pain so much that she thought she could just make a flippant comment of, "Do you want me to just have them cut you open?" And that's when I decided that I might need to seek a second opinion. So I reached out to a friend of mine who was diagnosed with endometriosis because I Googled my symptoms like any good patient does. And she said, "You need to see a specialist." And that's really when my world changed. I found Dr. Heegaard here in the Twin Cities, and then Dr. Palmer, and whoever could get me in first, I was lining up to go. And I wasn't ready to do surgery with just anyone. I really wanted a specialist. I'm not the kind of person that has ever had broken bones or any kind of surgery before besides my wisdom teeth. And so I wanted the best, and Dr. Heegaard couldn't get me in, so I worked with Dr. Palmer. And on my 31st birthday was the first time someone sat me down, read my 9 pages of medical history, and said, "I think you have this disease. You're not wrong. You're not crazy. This is painful. I think, based on looking at your symptoms, this is where I'm going to find it, and here's what we're going to do, and we're scheduling you for surgery." So that was in December of 2017, and in January of 2018, I had that surgery, and I remember going in and crying before going into surgery and thinking, what if he doesn't find anything? So literally the first thing I asked when I woke up was, "Do I have it? Did you find it?" And he said, "Yes." And it's the biggest stressor of emotions because you're so glad that they found something and you're feeling so validated, but at the same time, your worst nightmares come true and you have this disease. So it was right around this time that I met a couple of other women in the Twin Cities, and they were starting a nonprofit, and I decided to jump on board. So I'm the president currently of the Minnesota Endo Warriors. We're in our 2nd year, and I've turned my pain and my struggle into my focus and my drive for trying to get people answers sooner. I want people who are experiencing any of these symptoms, including infertility, pain with their periods, pain with sex, to know that there is an answer and that the doctor you're seeing right now might not be telling you the whole story. So I want to make it a little bit easier. It took me a lot of self-discovery and a lot of time on the internet. And if I could save you that year of pain, well, the 15 years of pain that I didn't know what was going on, but especially that last year where I had to tell doctors what to do and I had to really seek specialized care. If I can help you jump some of those steps, that's my goal. And that's exactly why I want to do this podcast and starting the nonprofit and working with people at all stages of the disease, whether they're just starting out and they're not sure that they have it and trying to find the right specialist and person to work with, or if you know you have it and you're dealing with new symptoms because the disease can change and evolve, or talking about alternative ways to deal with the symptoms, not just surgery and not just painkillers and medication, but diet, exercise, chiropractic care, acupuncture, all of those holistic things. I want to explore what that means and how patients can advocate for themselves, and then what you can really do to take back control. Because I think so much of my frustration has felt like I was out of control and like this was happening to me. And it's been a long journey to love my body again and, really appreciate the things that my body can do. And I'm hoping that I can help you guys skip a few of these steps so it's a little less frustrating.